Can Viagra slow cancer spread? Maybe, and that's not an evasive answer. There's a plausible mechanism and a compelling result in experimental models. What we do not have is proof that it reduces metastases in patients. That distinction is the whole story. PDE5 inhibitors like Viagra and Cialis improve erections by raising cyclic GMP, relaxing smooth muscle, and improving blood flow. The surprise is what that same rise in cyclic GMP did inside cancer cells in a new study. Cyclic GMP interfered with NPC1, a protein that moves cholesterol out of the lysosome and makes it available elsewhere in the cell. It did not shut down cholesterol production. It trapped more cholesterol in storage, leaving less available for cell membranes, signaling mitochondrial function and migration. The mechanism predicted that cancer cells should become less capable of moving. And that is indeed what the researchers found: less migration and lower metastatic burden across several cell and mouse models. Sildenafil was the main drug, but they also tested vardenafil, which is brand name Levitra, and genetically reduced PDE5A. And there is precedent for the target. Itraconazole, an antifungal medication, can block NPC1-mediated cholesterol transport directly. This is an elegant experimental arc. It is not yet a clinical result. A look backward through records from 40,567 cancer patients. These patients were not given sildenafil to treat cancer. The researchers classified prescriptions filled before diagnosis and then examined 5-year survival. 1 or 2 sildenafil dispensations were not significantly associated with lower mortality. 3 or more, however, were associated with lower mortality and a stronger association among patients also exposed to a statin. But the database did not include cancer stage or cancer treatment. It measured dispensations, not verified dosing or adherence. So the human finding is an association, and, well, association is not causation. An older Swedish registry also found lower colorectal cancer incidence among PDE5 inhibitor users with prior benign colorectal neoplasms. Again, interesting population data, not proof of prevention. Cancer biology is also context dependent. In experimental BRAF mutant melanoma, PDE5 inhibition increased invasion through a different cyclic GMP and calcium pathway. Human studies have not established that these medications cause melanoma, but the result reminds us not to tell one simple story about every cancer. For your prescription today, nothing changes. However, there is a real possibility that erection medicines may affect cancer spread in addition to improving blood flow. But there is no established oncology indication or oncology dose. Do not start, stop, switch, or escalate one because of this paper. Medicine is full of surprises. The scientific method asks us to stay open to them and equally honest about uncertainty. Thank you.